The first section talks about some challenges, which again has three parts. The second one talks about the vulnerabilities of this unsmart segment of the human beings of the city. And the last section talks about some thoughts on how we could probably address these challenges. This is just to give you an idea of the pace at which cities are growing. Here I would draw your attention to the fact that while urban areas grow fast, the unsmart part of the urban areas grow faster. So slums are growing at about 5 to 6% per annum. And the number of cities with 1 million population are also growing very fast, which also means the cities with 500,000 population or 100,000 population are also growing very fast. I mean, we will have the provisional results of this census probably in a year's time, and we'll get the true numbers. The first challenge here is that this unsmart component of the city is often undercounted, and you'll see the evidence. We studied several cities, because the first city I studied and we had meetings with officials in Delhi, nobody believed this. So we studied several cities and we found that the list of slums in the cities which were available officially, which were also used by the census 2001, were gross underestimates. And unfortunately, colleagues in the census office, even in 2011, do not believe this is true. But this was actually done with all the government machinery of that city. And it is a huge issue, because if we do not acknowledge human beings, the city will be so unsmart that we cannot even think of it becoming smart. The first thing is that you acknowledge that people exist. There are so many vulnerabilities in this unlisted segment of the city population that those vulnerabilities, if we do not even understand them, I don't think there'll be any modeling, any planning, any think tank which would then be able to address those. Some data, and interestingly, this data is from Government of India, Central Statistical Organization. And this data shows that there are sharp disparities between how the listed and unlisted slums have services. This is data from a study that we conducted, which shows the disparities in terms of access to very basic service like immunization. The second challenge is that in a city there are wide disparities in health and nutrition and environment. So this is about the disparities in toilets. Urban poor households, approximately half of them do not have toilets. This is data from the National Family Health Survey, which is monitored and guided by the Ministry of Health and Family Welfare, Government of India, and conducted by the International Institute of Population Studies. So this is not data from a one-off study which any agency has conducted. All the data that I'll share in the next few slides. Likewise, water, very few households have piped water in the house among the urban poor population. I just wanted to draw your attention to this picture where you see this child putting his hand under the drain. I was in a slum called Pragati Nagar in Indore, and I was curious to find out where they get drinking water. And this child, jumped and put his hand there. Presence of mind prevailed, and I clicked the picture. The next moment he pulled out this pipe and said, "जब पानी आ जाता है तो हम भर लेते हैं." Our primary healthcare services in urban areas are also suboptimal. The points that you see here are about the suboptimalness of those services, and these are from a study which was commissioned by the Ministry of Health and Family Welfare and conducted by IIPS. So this again is not from any civil society organization which conducted this study. And interestingly, this study has tried its best to show the urban primary healthcare system in as good a light as it could have. There is also uneven distribution of the primary healthcare facilities, because unevenness itself is very unsmart, and I thought I should bring this up. There are cities like Jaipur which have 75 primary healthcare facilities. And there are cities like Indore. Indore is incidentally larger in population than Jaipur. It has 17 and Agra 19. There are parts within a city which are totally left out or largely left out. Shahadra is a part of the city we are all sitting in, which has far fewer primary healthcare facilities as compared to several other parts of the city. There is a Trans-Yamuna part across the Yamuna in Agra, which has just one primary healthcare center and a population of more than 3 lakh. There is a part called Khajrana in Indore, has a population of about 1.5 lakh, no healthcare center. Inequitable access to maternity services. We would assume that in urban areas, because hospitals probably are 10 minutes, 15 minutes away, deliveries take place in home. But we find that a large proportion of them still take place at home and not in the hospital. This, of course, is data from 2005 and 6, and probably this aspect might have improved because we are 5 years from then. But still there is this issue that we still have home deliveries in cities, sometimes next to hospitals. Immunization coverage remains low, may have improved from the 40% that is shown here. Nutrition status is a very major issue, very closely related to the smartness aspect, because smartness has to utilize human capability. If we do not utilize human capability, we are very unsmart. We are actually ignoring the most core nature-provided substance for a city. And we have nearly 50% children who are underweight among the urban poor. We have 54% children who are stunted. And this is important also from the economic point of view. In the second fastest growing economy of the world, this segment will form the bulk of the informal sector workforce. 60 to 70% of India's GDP is contributed by the urban sector. They will form the informal sector workforce of tomorrow. If we can invest in their nutrition, cities will be smart, our country will be smart, we might become the fastest growing economy of the world, and not only just have to say it, probably there will be a stage when we don't have to tell people that we are the second fastest growing economy of the world. Because that is real smartness, when you don't have to talk about it. Another access related issue